Allison, welcome to the show. Thank you so much for coming on. I was just saying to Allison that I've been following her for a long time on social media, and I've been so excited to dive into everything that she's all about.
Yeah, thank you for having me. I love any chance to talk about endo, so I'm very excited for this.
Yeah, I know. I want to get straight into it. So, obviously, I asked you to come on the show mainly because I want to speak about endometriosis. Because following all of your content, I find it so educational, it's so inspiring, and I just love what you give out to others about endometriosis. Was endometriosis something you found fascinating when you were studying, or was it more so when you got into working with women? How did it kind of start with you being like, this is something I really want to focus on?
Yeah, I kind of got into it accidentally. So I went to Chinese medicine school in Vancouver to get licensed in acupuncture and Chinese herbology. And then right after I graduated, I got hired at a clinic that specialized more in like women's health and fertility. And so I got like a lot of really great mentorship and I just learned so much about hormones and gynecology and I just found it so fascinating and I was
Mm.
just so blown away that there's so much that we're just not taught about our own bodies and that's just kind of when I started falling in love with it because Chinese medicine was also such an effective tool for treating these things that western medicine doesn't really have a lot to offer or has limited resources to offer. Yeah, and then endo specifically was obviously like I had a lot of patients with endometriosis, either struggling with symptoms or struggling with their fertility or both. And
Mm.
then it wasn't until a few years into my practice that I was actually diagnosed with endometriosis. And I was actually kind of accidentally diagnosed with endometriosis. So
Wow.
my journey was like a little bit different because I didn't have a bunch of symptoms. I actually started getting symptoms of endo after I was diagnosed. But I went into my doctor's office wanting to get a blood test for iron because I've always been a little bit iron deficient. And I had this new doctor. She asked me how my periods were, and I was like, "Oh, they're fine, a little bit irregular, but not too bad." And she's like, "Oh, well, let's do a pelvic ultrasound." And I was like, "Oh, that's really cool." Being the like women's
Yeah.
health nerd that I am, I'm like,
I'm in.
"Yes, I'm so into this. I want to
Yeah,
see what my insides look like." So
totally.
I got that ultrasound, which revealed that I had an endometrioma on one of my ovaries. And that was how I was diagnosed. And it was kind of a big surprise. Because I didn't have a ton of symptoms. I've always had a little bit weird of periods, but nothing that really pointed me in the direction of endo.
Yeah.
But then, yeah, then I started learning more about it, obviously, because now I was struggling with it myself. And I
Mhm.
just wanted to learn every possible thing about it and how I can support myself with this disease. And then also my patients that were struggling with really similar things.
Yeah, and it's such I always find with well, especially since I mean, I heard the word endometriosis, I think maybe a couple of years ago when a friend was like, I think you have it. I was in such denial. I was like,
Mhm.
no way. I'm so fit. I'm so healthy. There's no way I've got endometriosis. Anyway, my period started getting worse. And then it was only last year, I actually was in hospital every month with these like
Oh,
flare, you
man.
call them. Yeah, it was awful. And then I met a naturopath because I was like, I just need help with my cycles and what's going on. And
Mhm.
immediately, with so much confidence, she was like, "You've got endometriosis," and I was like,
Wow.
"What?" So anyway, immediately she's like, "Go to this surgeon, get the laparoscopy, and then I'll treat you when the endometriosis is like out of your body, sort of thing, from that
Mhm.
surgery." And I was like, "Okay," and then I started researching endometriosis last year like a lot more, and it's just such a like a rabbit hole, so many different hats.
Oh, yeah.
People have different symptoms and different things and different
Mhm.
stages and different levels, and I was fascinated with this disease. And then I heard that it's more in your family and it's not something you can really just catch, because then I started
Yeah.
thinking, what am I doing wrong? What am I
Right.
doing wrong
Yes.
in my life?
Yeah.
I'm so health conscious. I try really
Mhm.
hard to watch what I'm putting in my body. Why have I got this chronic illness? But then on the
Yeah.
other side of that, I was like, this explains every single symptom I have. Like, I'm well known
Wow.
for napping because I had chronic fatigue, but I didn't know I had chronic fatigue.
Mhm.
I'm like, yeah, I just love napping, you know? And there was like obviously my painful periods and just like tiny little things that post surgery kind of all went away. And I'm like, wow, like that was affecting my whole life.
Mhm.
And it's kind of
Yeah.
devastating to be like, you know, I wish we got told that on day one of our period, that these
Yeah.
all could be things that you might stumble across through your cycle instead of waiting. I
Mhm.
think I was over 20 years undiagnosed to just be like, oh,
Wow.
I wonder what my life would have been like without it, you know? But
Oh, man. Yeah.
it's just the motivation, like to have conversations like these to spread awareness for like other women and people
Yeah.
that are, you know, younger than us, so they don't have to stumble across this thing and wait 20 years for someone to be like, it's normal, you know?
Yeah, exactly. It's so easy to brush off the symptoms. And you're so right about like the rabbit hole is exactly what I kind of like information is exactly how
Yeah.
I felt when I was first like looking for more information about endo because I'm like a very research heavy person. I love like knowing everything about
Yes.
like a particular topic. But there's like such a they're just like it was so hard to just kind of understand endometriosis because there was tons of like studies and lab reports and stuff and like all the science and stuff that you could go into, but I found a lot of it just wasn't translated into a way that like the average person could understand.
Yeah.
And especially when I was diagnosed, maybe I think 5 years ago or so, like there was only, I think like 10 total books like published about endometriosis
Wow.
that and I read all of them and I only
Yeah.
found like maybe like two or three of them even moderately helpful. A lot of them are just kind of weird or just not great information or just not like evidence based or anything. Like
Yeah.
today it's a lot better, but also, there's a lot of stuff on social media that can be hit or miss. So
So
navigating
true.
like the information overload and like underload of endometriosis
Yeah.
is such a maze.
Yeah, it really is. And that's what I find as well when looking into it. It's like, well, what's right and what's wrong? And when I was going through my
Mhm.
treatments, the most I learned was on like Facebook support groups, getting feedback from what
Yeah,
women have
yeah,
been through. And I'm like, this is crazy. Like, where do we get like, you know, we should have like a booklet or like a leaflet or something that's like, this is what you do and this is what
yeah.
happens. And I mean, there's women in there. My surgeon was incredible. And he was telling me about like the post care and that my
Mhm.
periods might be worse post cycle. And then I go into these groups and everyone's like, my period pain is so much worse after my laparoscopy. And I'm like, why
Right.
didn't your surgeon tell you that it could be worse? Like, we're just
Yeah,
there's
that's
so
so
many,
true.
yeah, so many different levels of information from different surgeons. Like, there's not like a kind of standard across the board. This is what gets
Yeah.
done. This is what happens. And this is what everyone
Yep.
should know when they're going through surgery or going through their cycle. It really is a crazy rabbit hole. So
Mhm.
well done for sharing your educational information to
I
women.
try.
Yeah, it's so good. So when women come to you, do you reckon or do you see anything that's kind of similar across the board with women when they come in and you're like, oh, I think it's endometriosis?
Yeah, there's definitely some warning signs that I'll definitely be on the lookout for my patients, whether they are also like think that they might have endometriosis or they've never heard of it. And I'm the first one to kind of bring it up to them. Like there's such a vast
Wow.
array. And then I'll have some patients that are like, oh, yeah, my doctor did a pelvic exam, or like I went to see my doctor, they did a blood test, and then they told me I definitely have endometriosis. And I'm like, wait, hold up. That's not
Yeah.
exactly how it works. The diagnostic process, can only really be done through surgery. And then,
Yeah.
so there's a whole spectrum of where people are when they come to me. But specifically, I'll look out for obviously painful periods, but specifically like painful periods that aren't relieved by just like over-the-counter Advil or Midol or something.
Mhm.
Like pain that's just not really relieved by your regular painkillers.
Yeah.
Um, and then like other pelvic pain throughout the month, like if you get random pain or ovulation pain, spotting before your cycle for more than 2 days, that's also a really common endo symptom. And then like a lot of digestive stuff is really common, or weird bladder symptoms. Those are the kinds of things that I'm really on the lookout for a lot of my patients.
Yeah, yeah, it's so interesting because when people talk about it, they're like, "Oh no, I don't think you do have it because you don't have this, this, and this." And then other people have, like you said, the mid-cycle pain or don't have period pain
Hmm.
and have ovulation pain. And we're all so unique with our symptoms that it's
Yeah.
like, well, you can't actually say, no, I think you have it or you don't have it because everyone is so different. Like on this
Yeah.
endometriosis scale, like it's so crazy where we come in at and what we say. But going back to like Chinese medicine, because I've been, like I said, with a naturopath and a herbalist, and I honestly think, as much as I don't want to rely on it, but the supplements and tonics that I'm taking, I think are saving me.
Yeah.
Like
Yeah, I bet.
I'm on a lot, but sometimes if I say like I'm reordering and they don't come in on time, like I notice such a dip in either my energy or my mood or how I'm feeling, and I'm like, whoa,
Yeah.
am I relying on these? I
Yeah.
don't care if I am, but they're like helping my symptoms so much. So I had
Oh,
to
that's
get,
great.
yeah, a gazillion blood tests done just, to see where I'm at and where my hormones were at. And I
Mhm.
actually think you posted just recently on social media about the, is it Chase Tree?
Oh, yeah, yeah, that was
Yeah,
today.
because this is what I was like, wow, that's when I was on because my prolactin was through the roof. Like literally, she was like, you
Oh,
look like you're breastfeeding twins or that you're like,
wow.
yeah. So that was one that was so high. And she said it was, she said to me, it was not one I would ever look at because it's not something I would think it would be high. But obviously, my
Mhm.
body's so stressed out from the endo and just the
Mhm.
chronic stress. And that supplement, she's like, let's get you on it. And the symptoms I
Nice.
had with that was obviously like such like painful breasts before my period.
Yeah.
Like they can't be touched, don't come near me, wearing a bra.
Yep.
Oh my God, it was so bad. But just from that like one supplement, it's gone. Like it's so
Oh,
crazy.
that's
I just,
amazing.
yeah.
Great.
So I'm just
Yeah, in
like,
the right circumstances, Vitex can be so helpful.
yeah, so that's what I was thinking. Because I guess, like, obviously, some people thrive on certain supplements and other people don't.
Mhm.
But
Yeah.
going into like supplements and, Chinese medicine and herbs and things, what sort of, is that something you give to people as like a package with the acupuncture? Is it something you recommend that people can, research themselves? Because I guess a lot of women,
Mhm.
what I've noticed and what I've seen in discussions is acupuncture okay for women with endometriosis? How do we know we're going to the right person? What supplements do we take? What herbs,
Yeah.
tonics,
Yeah.
So I guess you're the most perfect person to answer all these questions of women being like, can I do it? Should I do it?
Absolutely. Yeah. So basically, when a patient's coming to me during an initial consultation, like we sit down for an hour and we really go through all the symptoms, everything that's going on. And
Mm,
I definitely like Chinese medicine is holistic. So we're always
yeah,
talking about diet, lifestyle. And then I do have a little bit of a functional medicine background. So I'll definitely do some supplements. If we need to do any like further testing, then I'll suggest
mm,
that too. But I'm basically just like, as my patients are talking to me and giving me all the details of what's going on. My brain's just kind of piecing together of like what sort of things do we need to focus on holistically. So
yeah,
absolutely. Like we go into sleep, we go into digestive health, we go into nervous system support, supplements, a lot of diet stuff. Chinese herbs, should we need to like there's so many different modalities and like tools even just
yeah,
within Chinese medicine that can be
yeah,
really helpful. So yeah, I definitely do the whole thing. I'll depending on like which specific symptoms my patients are struggling with, but then also their health goals. Like, are they just trying to manage pain? Are they trying to conceive? Like, those are very different things and will look really differently depending on what their health goals are.
yeah,
But yeah, acupuncture, there's so much really cool research about acupuncture and endometriosis. And also adenomyosis, which is like the sister disease to
yeah,
endometriosis. There's also really good research with acupuncture and Chinese herbs. Because basically acupuncture, which is, inserting, tiny, tiny needles into different
mhm,
areas of the body to elicit a physiological response, it really
yeah,
works through the nervous system to activate the parasympathetic mode and to reduce inflammation. It helps balance hormones. It helps support blood circulation and healthy egg quality. So it has all these different kind of mechanisms that are really awesome for supporting endometriosis symptoms, whether it's like the painful periods or heavy periods, clotty periods, the digestive issues, the fatigue, because a lot of that is stemming from inflammation. Because at the end of the day, endometriosis is an inflammatory condition.
Mhm.
So anything that you can do to reduce inflammation is going to help. And that's definitely acupuncture and herbs too.
Yeah, it's so amazing. And it's kind of similar because I'm a breathwork coach, and breathwork literally covers a million different things that it can help in different ways. And I
Oh, I
feel like
bet.
that's the same as acupuncture, because I've had
Yeah.
acupuncture before and for different reasons, and it really does cover different things. And I think just for anything similar to breathwork, just going there and laying down and relaxing and being forced to just have
Mhm.
time to yourself in itself is just a beautiful experience. And you have something else that's helping your body at the same time, like it's just
Oh, definitely.
it's so lovely for people to go and do that. So for people say that are like, okay, I don't know what supplements to take, but what are like some basic things you would say for them to do, endometriosis specific, like at home, in terms of
Mm.
like their sleep or their health or their diet? Because I guess that's a whole other whirlwind as well, because I've noticed there's a lot of endometriosis nutritionist online as well. And
Mhm.
then there's people that say in the Facebook groups, like, well, this helps me. No, this doesn't help me. Like, there's
Yeah.
things, and which I've noticed too, there's certain things I've been playing with, specifically my diet, because I'm like, I
Yeah.
can't go through another painful cycle. And there's definitely
Mhm.
certain things that massively trigger me now that I'm really sensitive to. Whereas prior to that,
Okay.
I'm like, oh, I wouldn't have noticed that that was triggering me or not, just from like cleaning
Mhm.
up certain things in my diet. So yeah, what would you say? Is there certain things people can do with like diet, sleep, or just things like at home that's like, okay, this is things I can try today for my
Oh,
endometriosis?
definitely.
Yeah.
Yeah, for sure. I mean, some of my basics with supplements are like vitamin D, magnesium, omega-3 fatty acids, or fish oil. Like these are all fairly, harmless, easy supplements to take that you can kind of pretty much find anywhere. And these three are really good for targeting like immune health and inflammation and hormone balance, liver health, all those kinds of things. So those are definitely like three basics that I have a
Yeah.
lot of my endometriosis patients on. And then yeah, like I kind of go through, I've got like four basic pillars of health that I work with a lot of my patients.
Yeah.
It's diet, stress, exercise, and sleep. And
Okay.
so each one of those things is super important. Like we
Yeah.
cannot underestimate the importance of sleep. We definitely need to make sure, our body is getting, at least 7, 8 good hours of sleep.
Yes.
Exercise, regular movement is super important.
Hmm.
Diet wise, like there is no one endo diet. And I feel like that's one of the most confusing things about endo. Like,
Yeah.
do I eat red meat, sugar, gluten, dairy? Like there's so much confusing things. And
Yeah.
honestly, even the research is super vague because doing studies about diet is like nearly impossible
Yeah.
because it's there's too many confounding factors. People aren't
Yeah.
reliable for, recording diet and stuff. So it's kind of all over the place there. But in general, diet wise, it's really important to just reduce inflammatory foods in general. So,
Yeah.
like be mindful of caffeine and alcohol. Refined sugar is inflammatory for everyone.
Hmm.
Um, Experimenting to see if reducing in gluten and dairy helps. If it does, awesome. If it doesn't, not a huge deal. Make sure
Mm.
you're also incorporating a lot of anti-inflammatory foods. So like a lot of whole foods, leafy greens, good quality protein sources, a lot of
Yeah.
healthy fats, avocados, nuts and seeds, getting those omega-3s in. But then another thing that I find a lot of people overlook for diet, especially when it comes to inflammatory conditions, is just keeping your blood sugar really stable throughout the day. Because I
Yes.
find it's such an important way to control like your daily levels of inflammation. Because if
Yeah.
you're, skipping meals, waiting till you're super hangry before you're eating, intermittent fasting for too long, or even just like eating and like snacking and grazing constantly throughout the day, all both of those things can create a lot of like roller coaster for your blood sugar.
Yeah.
And we don't really want those high peaks and those low drops. We want our blood sugar to go up and down naturally throughout the day, but obviously nothing too crazy extreme, or that's going to cause a lot of inflammation. That's going to disrupt our hormones. So, eating regular meals, plenty of protein and fiber with each meal is really important. And I find that to be super helpful, especially in the week or two before your period. If you're really, really mindful of that blood sugar stability, it can be such a great way to reduce pain and inflammation.
Yeah, it's so true. And it's actually the one thing that my naturopath said to me as well about blood sugar. And then I
Mhm.
started following, is it the Glucose Goddess on
Yes, I love
Instagram? And
her.
I'm like, okay, yeah, she's amazing. So I started looking into her stuff and the way she eats. And that's one thing I definitely changed because I'm like, okay, let's try and, I'll just do anything to make sure I don't get this pain again. And the other
Yeah.
thing I did was I used to be years ago a really big coffee drinker, and then last year I'd have it now and again, but I completely gave up coffee and caffeine, and that
Mhm.
really helped me. Like,
Oh, man.
and in Australia, we're all such like big coffee drinkers and coffee lovers.
Yeah.
I just completely cut out caffeine, and then it's hard to say what has helped me because I'm doing. This is the other thing. I'm doing like, if I add it up, a million things to make sure
Yeah.
I don't get a flare up and I don't affect
Yeah.
my endometriosis. There's so many things I'm doing. If someone was like to me, "What do you think you're doing that's helping?" I'd be like, "Here's a list."
Yeah. I
All of the
know.
above is what I'm
Yep.
doing. But definitely, I think the caffeine helped. And I also used to exercise regularly, but like mix it up between like cardio, hit training, strength training. And I dropped all of it apart from weight training. So now all I do is weight training. So I don't do the
Nice.
hit training, running, cardio, just until my cycles kind of came back to what a normal cycle should be, basically,
Yeah.
whatever that
Yeah.
is. And I think that's really helped as well. As much as I'm like, I want to drink coffee, I want to go crazy on exercise sometimes,
Yeah.
don't do it because I know the effects of,
Yeah.
what it might do. Is is that something that you've researched or something that you've came across as well with like high intensity exercise for women and their hormones?
Yeah, there is a little bit more research out there now about that. Like there are some, especially like with different phases of your menstrual cycle, we do have
Yeah.
different kind of like physical sort of ramifications on our hormones. And there is some interesting research that's coming out that's saying like, oh, strength training is better for this type of your cycle, and this type of your cycle is better for like cardio and fat
Hmm.
burning and that kind of stuff. So there's that too. But generally, I find that like with people with endo, we're in chronic pain. And so our
Yes.
nervous system, our HPA axis is usually a bit more in overdrive than the average
Yeah.
person. So I find doing high intensity exercise can just stress out the adrenals too much.
Yeah.
So I find for that sense, but then also really high intensity exercise like running and high intensity cardio can be a little bit intense on the pelvic floor. And
Yes.
then there's a huge pelvic floor and endo connection too. Like a lot of us have really tight pelvic floors, like all the
Hmm.
muscles that are in our abs and our like pelvic bowl and everything, because when our body's in chronic pain or like through things like surgery, those muscles can get really tight and then have a hard
Yeah.
time releasing. So then like constant, hard shoes hitting pavement and stuff, kind of running and intense exercise might make those things worse. So yeah, I definitely see in general, high intensity exercise not awesome for people with like chronic pelvic pain and endometriosis. But it's kind
Yeah.
of interesting, like just as as varying as the symptoms of endo are, so are the treatments and everything too, because
Hmm.
everything is so individual, and what's going on and what helps one person can be completely different to another. And that's what I find like helpful, but also unhelpful about like the support
Yes.
groups, because yeah, for a good number of years, I was on the support groups too, like trying to figure out like what is everyone
Mhm.
else doing. And then I find it also just it can just give you more questions rather than
Yes.
answers.
Yeah.
And it kind of sucks that like we have to be our own doctors for this.
I know. Oh, tell me about it. It's been so crazy just trying to, yeah, do it all on my own. Especially like I'm literally relying on, like this, my naturopath that I've got. She's, a clinical nutritionist and herbalist and everything. And I'm just, relying on her to really help me through this. And she's, suggesting things I try, but also at the same time, she's like, but see what works for you, like
Yeah.
it's very
Yeah.
unique and you know your body better than anyone. So there is certain
Hmm.
things that I'm like, I know this is not helping my
Yeah.
cycle. And then there's other things that I'm like, I know this is really going to help my cycle. So there's certain
Hmm.
things, but I think, like you said, for me, I know that my body was highly inflamed. I had chronic fatigue, which means my body was stressed out. So I'm like, okay, what
Yeah.
things am I doing in my life that I can be like, okay, I'm going to take responsibility myself and my
Mhm.
whole life and realize what things am I doing. So for me, having coffee as soon as I woke up is like absolutely no, because
Yeah.
I want to stress my body more. High intensity exercise is going to make, my stress worse in my body. So I take that out. So there's certain things that I've taken out that have probably helped me more than the things that I'm adding in. So I think
Yeah.
people, if you really sat with yourself and your whole life and you had the education on, okay, this is like an inflammatory disease, it's chronic, this is where the pain is, this is what I'm feeling. And maybe if I can get my hormones checked, I can look at myself
Mhm.
like I can trial this and this and see what works for me. And I think a lot of us have actually had to do that, because you go to a
Yeah.
doctor and they're like, the last doctor I went to, which is so crazy because I work in mental health, and she's like, I'm explaining to her my symptoms. I'm getting really upset because I'm like, no one's helping me, just I need a
Yeah.
stronger painkiller, but there's like, she was like, I can't give you a stronger painkiller. And she says, I think you need to go on anti-anxiety medication. I'm like,
Oh, no.
I'm sitting here just like pouring my heart out. I'm like, I work in mental health. I know
Oh, man.
I know what depression is. I
Yeah.
know what panic attack is. I don't need
Yeah.
anti-anxiety medication, but it really broke my heart leaving the doctors thinking, imagine other women that go in there like me, really upset, pouring their heart out, just be like,
Yeah.
health professional, help me. And she's like, you need an anti-anxiety medication. Like, it's just heartbreaking. Like, these women that are taking
Yeah.
medication that they probably don't even need. Like, it's really sad. Yeah.
Yeah, and I think it's really important to know that, like, also our family doctors don't know a lot about endo, and that's not really their fault either. Like, they weren't trained in endo. They maybe had, like, a 5-minute seminar of in like the whole gynecological whatever year that they had, and it's not really their fault either. And we can't really, put all of our treatment and hope into just one doctor. Like, I really do think because of how complex endo is, we really do need that healthcare team in
Yes.
order to really get proper care. Like, we need access to our family doctor, but we also need a good gynecologist and a
Mhm.
good surgeon, like a good naturopath or acupuncturist or pelvic floor physio. Like, I find we get the best treatment with endo if we're not like putting all of our eggs in one basket, and we're really, getting like good advice from specialists in their field that really know what they're doing. And that's kind of also the thing, like if you're trying to seek out a holistic healthcare professional, that they also have further training and like a specialization in the thing that you're kind of looking for. So not every acupuncturist is going to be awesome at treating endo because they
Yeah.
might not know what it is. Like, it's kind of important to, when you're like looking up people, that it says in their bio or like says in like on their website, it's really clear that these are the kinds of things that they treat, because they're going to see it really often. They're going to have so much more expertise. They usually have further training in it, and they really know what they're doing. So I think that's a really important part when we're thinking about going to our doctors and investigating whether or not we have endo.
Yeah, it's so true. Because I recently went to a pelvic floor physio. It was the first time since my surgery that I went to one, and she was just experiencing endo, and it was really amazing. And it was
Mm.
something as a woman you just want to keep doing. It's like the amount of people that have just been down there, had my
Yep.
prodded about, touched that area. I'm like, oh, here we go again. But she was so lovely and gave me like all these exercises to do because I had just one jacked up muscle. But the amazing
Yeah.
thing to me, she was like, do you do a lot of breathing? I'm like, well, yes, I'm a breathwork teacher. And she was saying how, obviously the breath helps so much in relaxing your pelvic
Yes.
or abdominals, all the muscles like in the place where it gets jacked up. So I had everything was fine around the area, but just this one muscle in the bottom left of my pelvis was just like frazzled, completely frazzled,
Oh, interesting.
isn't it? And I was like, this is
Yeah.
great. So I'm like, tell me more. So I had like exercises just for this one little muscle in the left that was just, and that's the one that just fires up when I get the excruciating
Wow.
pain. So doing
Mhm.
I have to do these exercises daily to, relax them and make them realize that, hey, the endo's not there anymore. Like you don't need to have a,
Yeah.
which they were doing. But with all the things, it really is, it's a shame, but it's like a full-time job that
Yeah.
we all have to work through, like pelvic floor and
Oh,
holistically looking after ourselves,
yeah.
diet, sleep, supplements, exercise,
Mhm.
and the constant, the thing is, the stress is like the constant trying to keep up with, is this okay for my endo? Is this okay? And
Totally.
it's
Yeah.
really like this full-time thing that kind of takes over your brain and your life,
Yeah.
because you're doing everything you possibly can to make sure you don't get another flare up, more pain.
Yeah.
I don't get the endo belly that everyone talks about, that the bloating.
Mm.
Sure, like that's
Mhm.
a thing that people have to watch, that they're not eating or doing something where they flare up in their belly space. Yeah, it
Mhm.
really is crazy.
Yeah. Yeah. Oh man, it kind of is a part-time job. And I don't want that to like dishearten anyone
I
too, because
know.
I find like if you start small and just like start building up the healthy habits too, it becomes easier to implement
Yeah.
and then just becomes more habitual and just a lot easier. But also at the same time, like it's once you see how good you can feel, even despite having a chronic illness, it's so much like it gives you that motivation that it's working, it's worth it. Like when like I've never felt, I think the past couple of years is like the healthiest I've ever felt, like compared to the whole decade of my 20s and stuff. And it's because I'm taking so much better care of myself and I really fine-tuned my treatment plan and I really know what works for me. And once you find what works for you, like feeling ill from veering off that path and not doing the things just totally isn't worth it.
Yeah, it's
But I
so
also I think it's when you have a chronic illness, like there's going to be ups and downs, and that's kind of a normal part of having an illness. Like
yeah.
even if you can't like 100% prevent endo from flaring up, even if you're doing everything right. I think that's also an important thing to keep in mind, that you can literally be doing everything right. And then sometimes you still get a painful period or once in a while, or like this other weird symptom kind of temporarily comes back. But I think it's just important to also just like practice that self-care and compassion and being gentle with yourself and giving yourself that time and space to kind of navigate your symptoms as they kind of progress throughout life is really important too.
Yeah, it's so true. And like, I like what you said, how, becomes like this habit, because it's true. Because when I look back, everything I'm now doing is just so natural. Like, I'll just naturally
Yeah.
take my supplements after like a meal. And
Mhm.
I know which days I'm like going to the gym, and I know which days like I'm walking. And
Yeah.
and it's the same when I started really looking after my mental health. It's like, okay, like going a day or a couple of days without doing like breath work or meditation, I can feel like anxiety in my body. I can feel the stress,
Mhm.
or I notice the way I react. And I'm like, this is so not worth missing a few
Yeah.
days of like breath work or meditation. Like, absolutely not worth it. So putting that mindset into things like, looking after your body and looking after yourself with endometriosis, you can just
Mhm.
make it your life. And then when you do veer off, you're like, wow, it really isn't worth it. And it does.
Yeah.
You feel good. And it's crazy, because the things that you have to do to look after yourself, I guess, with any chronic illness, is you're basically just making yourself healthy. Like, you're looking at
Yeah.
your health. So you're obviously
Mhm.
feel good. And then you do notice when you come away from that. So it is, at the end of the day, motivation to be like, okay, how can I look after myself, a little bit better each day? Yeah.
Yeah, exactly. Exactly. Cause I mean, all of us at some point will have to focus on our health. Like no one has perfect health their entire lives. Like it might be when you're 50 or 60 and your blood sugar is a bit off or your blood pressure is a bit high, that forces you to kind of think about how you can live healthier and everything. But I kind of like to see it as, having a chronic illness kind of gives you the gift of figuring out your health sooner rather than later. So hopefully you do have better long-term health in the long run, and making those healthy habits is a lot easier to do when you're in 20s or 30s than it is when
Mhm.
you're like 50 and 60, when you've been doing the same thing for that many decades. So you kind of have to look at the silver lining and the benefits to things too, or else it's just going to be way too depressing.
It's so, well, that's the other thing. It's so true. And I think that's why I like working in the mental health space and trying to get, women with endometriosis to come in and do, breath work and meditation, because every time I'm in the midst of like a really bad flare up, I'm always saying to like my partner, oh, like, I'm so thankful I have my tools every day for my mental health. Like,
Yeah.
because the thoughts can get really dark. So it's like,
Yeah.
but I know I'm not my thoughts. So it's like,
Mhm.
people doing that are in this, that aren't unable to manage their mental health, like, how are they coping mentally going through those really bad flare ups? Because I know I can rely on things each day which makes the flare up mentally a little bit okay or a little bit better, because mentally I'm like, I'm not my thoughts, it's going to pass,
Yeah. Yeah.
my breath knows where to go, my mind,
Yeah.
I can control it sometimes in the flare up.
It's always a work in progress.
Yeah, yeah, but it can be really, you can go into a really dark place, and I feel
Yeah.
really, I feel for people that are in those places that are just like, what do I do? Where do I go
Yeah.
mentally? Because your mind, it can go into overdrive. It's trying to protect you. It can go a little crazy.
Mhm.
Um,
Mhm.
and I just want people to be like, okay, what do I do with this? How can I like
Yeah.
focus on something every single day just to make myself a little bit better? Yeah.
Yeah.
Is there
Yeah,
things that
exactly.
you recommend for people with their mental health? Because you said that obviously stress and things is a part of what you work with your clients as well.
Mhm. Yeah, definitely. I mean, I'm a huge fan of any kind of mindfulness practice, and that
Mm,
can be whatever resonates to anyone's, whether
yeah.
it's like meditation, guided imagery, breath work,
Mhm.
yoga. Sometimes I'll even just tell my patients, like, you just need to do 20 to 30 minutes of something like chill each day and something very
Yes.
low stim, because I am a big believer that we need to do something each day, not just like, oh, when the weekend hits, that's when we can relax. Like, I really do
Yeah.
think there needs to be something each day to really get us back into parasympathetic mode,
Yeah.
because it's important to know that like our bodies can only heal when we're in parasympathetic mode. If we're in chronic fight or flight and we're really struggling with a lot of symptoms with endo, our bodies are not going to be able to heal and kind of repair
Mm,
and decrease that inflammation. So it is a really, really, really important and underrated part of dealing with endo. So yeah, I mean, I'll having some kind of relaxation practice, whatever that looks like to people, journaling, therapy, support groups,
mm,
having a friend that you talk to that also is struggling with it, going for walks, going into nature, reading a
yeah.
fiction book. Like the options are seriously limitless, and
Yeah.
it's just whatever you find relaxing, but also like what you find that's like joyful too, because I find that
Mm,
rest and joy are really the antidotes to stress and like a hyperactive nervous system. So however you can bring those two things more into your life is really going to help in the long run.
yeah, it's so true. And I always say that as well, because for some people, like meditation, breath work doesn't work for them. It's like, well, find
Yeah.
something that does work for you. Like you can literally just get out in nature, get your feet in the grass, the sand, the ocean.
Yeah,
There's so many
exactly.
you can do. And even down to like making like your tea or your coffee, you can literally
Yes.
meditate and be mindful of just doing these tiny little things during the day that I think people think that they have to do these really big, huge
Mhm.
things to get this mindfulness aspect or to reduce their stress. And it's like, no, you can like incorporate it into your everyday things. Like
Exactly.
some of my clients brush their teeth and they just play like affirmations, or they have affirmations on their mirror when they're brushing their teeth, like
Oh,
just
that's a good one.
yeah, just like get them into a really nice space first thing in the morning. When we brush our teeth in the morning, normally most of us are pretty much looking in a mirror when we're doing
Yeah.
it. So you can either have something on your mirror or you can like play something next to you
Yeah.
as you're doing that. Like there's so many, little things that you can do. Yeah.
Yeah, absolutely.
Yeah. And there's two things I wanted to ask you about as well. So you've got period university and endometriosis.
Yeah,
Do you want to share a
I
little bit
do.
about
Yeah.
that?
Sure. So, Period University was my first online course that launched last year. And it basically just teaches you everything that we were not taught about our periods and how to fix like common hormonal imbalances and basically just how to balance your hormones and fix your period. And we go through nervous system, we go through liver health, gut health, we go through supplements, we fertility awareness, all the different things and hormones. And then Endometriosis University is going to be launched, I'm hoping in March. I'm still working on it.
Okay,
There's
cool.
currently like a sign up wait list on my Instagram page to get like first notification and a discount. But navigating this whole illness and doing all the research that I have and knowing that there's that rabbit hole again of like there's so much
Mhm.
information but also not enough information, not enough useful information for endo. So
Yeah.
this course that I'm creating is to help like bridge that gap and have that like one-stop shop for everything you need to know about endo, how to
Yeah.
navigate, the supplements, everything you need to know about surgery and the different like medical options for like like drugs and stuff.
Yeah.
And we also talk about liver and digestion and the nervous system and all these things that really impact endo and all the things that you just really need to know.
Yeah, amazing. That's so good. And it's definitely needed. And I think people listening will definitely benefit from it because it's something like, oh, I wish I could have done that before my surgery,
It's
but
never too late.
yeah, and I think the blessing in disguise was with me. I just kind of got rushed into it when I met my surgeon and told him my symptoms, and he's like, "What? Let's go!" So it was a blessing in disguise. And the final thing was as well about you're mentioning liver. Are you a fan of castor oil packs?
Oh, I am. I love castor oil packs.
Yeah,
Definitely.
they're like
Yeah,
my
they're great for liver detox, for like pelvic pain,
yes.
cysts, all that stuff.
Yeah, so good. Because recently I went in my rabbit hole and discovering them. I think it's been like, yeah, a few months now, and I started researching castor oil packs and I've been using them.
Mhm.
I love them. And I feel like it's just the act of putting it like on your belly, having the pack around you. Like it feels
Yes.
so, it's like a little cuddle for your belly.
It
Like it feels
does.
so
It's
nice.
really cozy. It's really relaxing. It forces you to just like stay
Yeah.
put and just chill. Yeah, I love it. It's such a great ritual. I try to do them at least once a week, but I love recommending it more often, especially if you have a lot of pelvic pain or right after surgery. It's really great for helping to help with the healing and to prevent adhesion growth.
Yeah, yeah, because I've noticed that the scars that I do have from my surgery are nearly gone, and I feel like it's from wearing like my castor oil pack. But what I've noticed as well, like with the trial and error of wearing them, is I kind of wear them when my period stops to like ovulation, because I find that if I wear it like from ovulation to when my period starts, it makes my period a lot heavier, and when my period is heavier, it's
Ah,
sore. So I've kind of timed it now where I just wear it every kind of second day in that period of time,
oh,
and then
nice.
ovulation I kind of stop because
Yeah,
okay,
that
it's
makes sense.
yeah. So again, it's another thing of like you got to play around with these things and see what
Yeah.
works. Yeah. Yeah, cool. Is there anything else you want to share to any endo warriors listening or anyone that's listening and want to know more about their period?
Sure. I mean, I post so much stuff about hormones and endo on
Yes.
Instagram all the time, so I'm super active there.
Mm,
But also, I think it's just important to know that there's endometriosis is not your fault. Having a chronic illness is not your fault. It's kind of bringing back to what you said in the beginning is like, oh, am I not healthy enough? Did I do something wrong? Like having a chronic illness is never your fault. But there's also always stuff that you can do to improve your symptoms. So don't ever feel like you've tried everything and that it's not worth like trying that one other thing or looking into something else. Like there's never a dead end for endo. Like there's always something else that we can do or try or look further into to
yeah.
kind of, optimize a treatment plan. So yeah, I think I just want to leave endo worries with a little bit of hope in this very really tricky disease to manage,
Mhm.
that there's always something you can do. And honestly, the little habits and just starting somewhere can make such a huge difference in the long run. And you can't underestimate the small things.
Yeah, so true. So true. Well, thank you so much for your time. I really appreciate it. And like I said, I love following your work on Instagram. I think I follow you on Instagram and TikTok. And I just love the things you share. And I think everyone else will. And I'll attach your handle and your details down below. And I think if you got is it a link tree that your period
Yep.
university and endo university, so I'll attach that in the show notes. So yeah, people
Great.
can reach out to you as well. So thank you so much. And
Thank you for
so
having me.
lovely to meet you. And yeah, guys, reach out to her, have a look at her stuff, and I'm sure you'll learn heaps.